critical multi-system crisis in a 54-year-old male with severe untreated CRPS and significant initial injury. Presenting physician, me. Doctor, your name, my name. Presenting the case of a 54-year-old male patient with a known history of severe progressive complex regional pain syndrome, CRPS type. I2, if known, otherwise state unspecified, following an accident on February 20th, 2025. The initial injury on February 20th, 2025 involved torn tendons and tissue damage, and since that time, the patient has experienced extreme pain, including severe allodynia, pain from light touch. Crucially, despite these debilitating symptoms, the patient reports having received virtually no comprehensive care for his CRPS, with pain management limited solely to lidocaine patches. This means his condition has been largely unaddressed for over 3 months, leading to a profound and rapid systemic progression. This patient now presents with a rapidly escalating and critical constellation of symptoms indicative of profound autonomic nervous system dysfunction, encompassing elements of an autonomic storm, with direct and severe implications across multiple organ systems, including the cardiovascular system and central nervous system. Key presenting concerns: acute worsening and progression due to untreated state. 1. Acute cardiac/autonomic instability. Today experienced his first reported significant bradycardia, slowing heart rate. During a shower, developed acute lower extremity numbness and profound tingling/paresthesia, no circulation sensation, followed by lightheadedness and overt heart rate deceleration, necessitating lying down and leg elevation. Crucially, this was immediately followed by what the patient describes as convulsions, or severe body shaking/tremors, concurrent with a dramatic perceived drop in body temperature. Literally dropped to about 40% of 70 degrees in my house. Patient reports his heart still feels strange 7 hours post-episode. Concern: this profile strongly suggests an autonomic storm, with elements of severe sympathetic and/or parasympathetic dysregulation, leading to potentially life-threatening bradycardia, hypothermia, and extreme motor/sensory responses. Given the untreated progression of CRPS, this points to a critical decompensation of the autonomic nervous system. 2. Progressive autonomic dysregulation, chronic/worsening. Heart rate. Beyond the acute slowing, patient reports ongoing issues with heart rate fluctuations. Given the widespread autonomic dysfunction, decreased heart rate variability, HRV, is highly probable, increasing long-term cardiac risk. Temperature regulation. Chronic and now acute episodes of temperature dysregulation are consistent with CRPS's impact on thermoregulation. The described severe coldness is particularly alarming and raises concerns for hypothermia and its cardiac sequelae. Gastrointestinal dysmotility. Patient reports significant digestive problems, strongly suggestive of gastroparesis due to autonomic neuropathy affecting vagal nerve function. This carries risks of malnutrition, dehydration, electrolyte imbalance, and unpredictable medication absorption. 3. Severe and progressive cognitive dysfunction. Patient reports a 3.5-month history of escalating cognitive issues, including confusion, writing in reverse order, and perceptual errors. Looks fine 1 minute, realize mistake next. This is characteristic of CRPS brain, or cognitive impairment associated with chronic pain, neural inflammation, and critically, the prolonged lack of comprehensive CRPS treatment has likely contributed to its rapid onset and severity. 4. Profound and progressive emotional lability. Patient reports severe emotional difficulties, including explosive anger triggered by minor stressors and uncontrollable, debilitating depressive episodes, something taking over. This is consistent with the known impact of CRPS on brain regions involved in emotion regulation, exacerbated by the immense psychological burden of chronic debilitating illness and the absence of adequate pain management or disease-modifying therapy since the initial injury. Summary and assessment. This 54-year-old male patient presents with a severe, rapidly progressive, and multi-system manifestation of CRPS that has evolved into a critical state of autonomic dysfunction. The initial injury, involving torn tendons and tissue damage, accompanied by severe allodynia, highlights the extreme nature of the pain and neurological involvement from the outset. The absence of comprehensive CRPS treatment since the accident on February 20th, 2025, likely accounts for the rapid and profound systemic involvement observed. The recent acute episode, characterized by profound bradycardia, hypothermia-like response, and convulsions, demands immediate stabilization and comprehensive inpatient evaluation. The concurrent and escalating cognitive and emotional dysregulation further underscores the systemic nature and severity of his condition. Recommendation/action plan. Urgent and comprehensive. 1. Immediate emergency room evaluation. Urgent medical assessment and stabilization of current cardiac and temperature abnormalities. Continuous cardiac monitoring is essential. 2. complexity, severity, and acute nature of multi-system involvement, inpatient admission to a facility with expertise in complex neurological disorders and autonomic dysfunction is strongly recommended. 3. Rapid multidisciplinary consultation. Cardiology. Urgent consultation to assess heart function, rule out acute cardiac events, and manage profound bradycardia/arrhythmias. Neurology. Autonomic specialist. Critical for comprehensive autonomic testing, tilt table, QSART, etc., to precisely characterize the dysautonomia and guide targeted interventions. CRPS pain management. To urgently initiate appropriate, comprehensive CRPS treatment given the prolonged lack of care and severe progression. This includes addressing the severe allodynia, neuropsychology/cognitive neurology, formal neuropsychological assessment and brain imaging, MRI, to fully delineate cognitive deficits and underlying mechanisms. Gastroenterology, to manage gastroparesis and ensure adequate nutrition/hydration. Psychiatry/psychology, for immediate crisis intervention regarding emotional lability and depression, and to initiate appropriate pharmacological and psychotherapeutic strategies. 4. Aggressive symptom management. Pharmacological management for cardiac stability, neuropathic pain, especially allodynia, GI dysmotility, and mood/anxiety disorders. Consideration of advanced CRPS therapies, if appropriate, within the context of systemic stability. Supportive care for nutrition, hydration, and sleep. Prognosis. Given the severe, untreated progression of CRPS originating from significant initial injury, the profound allodynia, and the current critical multisystem involvement, the patient is at extremely high risk for continued and escalating cardiac events, including cardiac arrest, irreversible organ damage, especially brain and heart from hypoperfusion and autonomic storms, worsening functional decline, and severe psychosocial morbidity. This case represents a severe neurological and systemic emergency, requiring immediate, comprehensive, and aggressive medical intervention. This summary now incorporates all the critical details you've provided. Please proceed.